Cardiac nuclear medicine. What is cardiac nuclear medicine?
Cardiac nuclear medicine is basically used to diagnose diseases of the heart. The two major areas are detection of what we call myocardial ischemia, and that is shortage of the blood to the heart muscle in relation to coronary artery disease. And the second major area is in detection of myocardial viability. Those are areas of the heart muscle which are hibernating. They're not dead yet. They are hibernating, but they're not contracting. So we need to detect those areas of the heart so that if we restore the blood flow to those areas of the heart, they come back and contract and contribute to normal cardiac function.
What is an ECG?
ECG stands for electrocardiogram. Basically, it's a record of the electrical activity of the heart, and that is obtained by placing electrodes in appropriate places on the surface of the body and connecting it to an electrocardiograph, which records this electrical activity of the heart.
What is myocardial perfusion scanning?
Myocardial perfusion scanning is basically a nuclear medicine technique where we inject the patient intravenously with an appropriate tracer designed for looking at perfusion or blood flow to the cardiac muscle. For example, we can give technetium-99m system-MeB or tetraphosmin or thallium-201 chloride, which basically go through the coronary arteries into the heart muscle and tells us how the muscle is being perfused. That's what's called the cardiac perfusion imaging.
What are the benefits and risks of myocardial perfusion scanning?
The benefits of myocardial perfusion imaging is tremendous. Basically, it's a very time-tested procedure for accurate diagnosis of coronary artery disease in patients. So that's the major benefit for us to establish which patients, for example, who are presenting with chest discomfort actually have cardiac origin disease as opposed to other causes of chest discomfort. The risks are basically similar to what we discussed with general nuclear medicine. They are very small in relation to the radioactivity that is administered to the patient. So again, the benefit to risk ratio is huge.
What is cardiac gating?
Cardiac gating is when we connect the patient, we use ECG, electrocardiogram, to synchronize the imaging acquisition from the camera system when we are doing cardiac imaging tests. The reason for that is that we can actually look at the function of the heart, the beating of the heart during imaging acquisition. That's important because we can get information about cardiac function in which such indices, for example, have left ventricular ejection fraction, which is an important parameter for us to know. So gating is used in conjunction with imaging to give us functional data on the heart.
What is a stress thallium test?
People usually call it a stress thallium test because previously thallium was one of the most common tracers used. But basically, it refers to the procedure of doing a cardiac perfusion imaging study. And in that, we normally have a patient imaged after or during a type of cardiac stress. Most commonly, it's when a patient runs on a treadmill or on a bicycle ergometer. But it can also be done pharmacologically, not necessarily through some sort of a dynamic exercise. That's the stress portion of it. And the thallium really refers in general to the tracer that is administered. It could be system-MeB or tetraphosmin or thallium. And that's basically what is within that term of stress thallium.
How can I prepare for a cardiac nuclear medicine test?
The patient is asked to fast for a few hours prior to coming to the nuclear cardiology laboratory. Also, we want them to be well hydrated. They can take their medicines as before. If they are going to be stressed through pharmacologically, which I can mention the names are dipridamol, for example, or adenosine, Those also require the patient to stay away or not drink caffeinated products, including coffee, tea, and soft drinks that have caffeine in them, because those the caffeine interferes with the effectiveness of those drugs that we use during the procedure. Therefore, the preparation is quite simple, and again, depending upon what type of stress we use, we may ask them to stay away from caffeinated products.
What does the equipment used in a cardiac nuclear medicine test look like?
Well, the equipment are basically what we call single photon emission computer tomography, or SPECT systems. And these are usually gamma camera systems that have what we call 2 heads or 3 heads. The heads are basically the detectors, and which surround the patient, and they are able to acquire or record the gamma rays that come off of the patient. And those data are used by the computer again to form an image of the heart.
How is a cardiac nuclear medicine test performed?
The cardiac nuclear medicine test is performed after the patient arrives in the clinic. Basically, they are interviewed, again, making sure that the test is appropriate, the patient has been prepared adequately and appropriately. Then they usually receive what we call a rest scan, and that is that the patient is injected intravenously with an appropriate radiotracer, and then after a few minutes they are placed into a scanner, and images of the heart are obtained. These are called the rest images. Then after that's finished, a second phase of the study will be performed, and that's the stress portion of the image. In the stress portion, the patient is connected to electrocardiogram by placing electrodes on the body, and depending upon what type of stress is performed, the patient is prepared appropriately for that. So for example, in most common cases, the patient goes on to a treadmill, and they start exercising on a treadmill according to a specific protocol. And when the heart rate of the patient gets to some point, which is considered the peak for injection of radiotracer, that radiotracer is administered at that point at the appropriate cardiac stress level. During all this time, the patient's blood pressure is also recorded. The electrocardiogram is dynamically recorded to make sure to look at the electrocardiogram for any ischemic changes. And then after the radiotracer is injected at peak stress, the treadmill, for example, is slowed down, and the patient is taken off the treadmill. They relax for some time, and then after that, the patient is taken to the camera system for taking additional images, and those additional images are called stress images. Finally, the stress images are compared to the rest images by a nuclear medicine physician to determine if there was in fact a stress-induced ischemia, because ischemia or shortage of blood to the heart usually occurs when the heart is under stress and needs to work harder. If the coronary artery that is supplying some area of the heart is narrowed, is not unable to deliver the adequate amount of blood or that radiotracer, and that we can see when we compare it to a rest study.
What will I experience during a cardiac nuclear medicine test?
The procedure itself doesn't really cause any specific types of sensations. Again, there may be a little pain at the time when the radiotracer is administered intravenously, but other than that, there is really no side effects associated with the radiotracers themselves. Very rare that we talked about in the past. The patient just lie down, or sometimes in some cases they sit down in a chair, and the camera system is around them and take the pictures. There is really no sensation, a specific sensation associated with that. On the treadmill, they may get tired because they're running, for example, or they're doing exercise. And of course, if they have coronary disease, they may get their usual chest pain or angina with increasing cardiac workload during the procedure. That is really not specific to nuclear medicine, but it's a side effect or the side issue in relation to the stress that the patient is undergoing for us to appropriately perform the protocol. If the patient is stressed with pharmaceuticals, for example, dobutamine, dipyridamole, adenosine, they may also get some specific side effects. For example, they may get headache with some of the pharmaceuticals such as dipyridamole, or they may have some chest pain which may or may not be the same as angina that they have outside of the hospital.